Treatable. Really, it's treatable. Yes, it's treatable. It's the Treatable podcast. Say what's on your mind. It's the Treatable podcast. Real, coming, treatable. It's the Treatable podcast. It's all on the Treatable podcast.
If you're a parent or a teacher or anybody who works with kids, you might have seen them exhibit some interesting behavior, something that might have seemed a little bit off. But how do you know if it's just them being a kid or they might have a serious mental health challenge? And if they do have a serious mental health challenge, what do you even say to them? How do you talk to them in a way that allows them to open up, to feel understood, to feel heard? Welcome to Treatable. I'm your host, Clint Mally. Today we're going to be unpacking a topic that's been a bit of a hot topic in the last few years, especially in the post-COVID era. We're talking about children's mental health, and I couldn't have asked for a better guest to join me than Dr. Christine M. Crawford. She is the Associate Medical Director for the National Alliance of Mental Illness, also known as NAMI, which is our country's largest grassroots mental health organization, and the author of You Are Not Alone for Parents and Caregivers, the NAMI Guide for Navigating Your Child's Mental Health. She is an assistant professor of psychiatry and vice chair of education at the Boston University School of Medicine, and also provides outpatient psychiatric care to children and adolescents at the Boston Medical Center. Additionally, she's the medical director for the Boston Public Health Commission's school-based clinician program, in which she provides direct guidance on how to best support the social, emotional well-being for children within the Boston public school system.
Treatable podcast. It's all on the Treatable podcast.
So you're doing a whole lot. Dr. Crawford, thank you so much for joining me on the podcast today.
Thanks so much for having me.
Okay, so people in the mental health industry, they have heard of NAMI, they know what NAMI is, but for anybody who's listening or watching, before we jump into the topic today, what actually is NAMI? What do you do at NAMI? How do you help people? That kind of thing.
Well, first off, thank you so much for having me and providing this opportunity for more people to know about NAMI, because it's such an incredible resource. Now, NAMI is an organization that's available across the country. We have chapters in every single state, as well as local chapters in various communities. And NAMI provides support for individuals who are living with mental health related issues, as well as we provide resources for the loved ones in their lives, the caregivers, so that they can better understand these mental health conditions, as well as understand how to navigate the mental health system so that people can get the help and care that they need. So we provide support groups, we provide educational workshops, different seminars, and our website has a whole host of information about specific mental health conditions and available treatment options, because we really want to empower people with the information that they need to take care of their own mental health. And in addition to all the educational resources, the support groups, we're also an advocacy group, because we want to make sure that policy reflects what it is that people who are living with mental health conditions need in order to thrive and lead productive lives.
Absolutely. And just so people are clear, you're a nonprofit, right?
That's correct. We are a nonprofit. We are the country's largest grassroots organization that's dedicated to supporting the lives of people who have mental health conditions. And in addition to that, we have a whole host of volunteers who help staff our NAMI helpline. So people can call up NAMI if they have questions about mental health related resources, mental health conditions. So yes, we are a nonprofit that's full of volunteers who are really passionate about raising awareness about mental health and supporting people within this community who are living with mental health related symptoms.
Yeah. So, there's a lot of mental health organizations out there, and you always have to ask yourself, what's in it for them, right? And so what's important to remember about NAMI is they're not trying to sell you anything. They're just trying to give you helpful information. They don't have any services that they're providing. They're not trying to charge you anything. They're just trying to give you helpful information to support mental health in the community. And specifically today, we're talking about kids' mental health. And so maybe talk to me a little bit about the stage for why children, and when we think about children under the age of 18, right? Any kids, why has that become a focus for NAMI? And what are you seeing right now when it comes to kids' mental health?
Yeah, I think for a long time, we were thinking about mental health conditions that would have symptoms that would appear when an individual was a young adult or when they would transition to college age and then develop significant mental health symptoms. But what we have noticed and what we know to be true looking at all the data is that there are signs and symptoms of a variety of different mental health conditions that appear early in childhood. And oftentimes, those symptoms are overlooked, they're ignored, and kids grow up to experience a whole host of challenges because they didn't get the help and support that they needed. And so that puts them on a completely different trajectory as they enter into their adult lives. And what we know to be true is that early intervention, it's so important and allows people to live meaningful, productive lives while also living with a mental health condition. So if we're better able to recognize and identify mental health related issues early, then we can ensure that our kids grow up to really enjoy their adult years. We also know that young kids who are preschool age, kindergarten age, elementary school age, can also experience significant mental health issues. For so long, we thought about young kids as being incredibly resilient. They're not really fully aware what's happening. They're kind of just living their lives as innocent children. But what we know to be true is that kids are capable of experiencing depression, anxiety, have behavioral responses to very traumatic events. And so we don't want too much time to go by before we address those issues because each and every day of a kid's life is so important and so impactful for their development. So NAMI recognizes that we have the information available to share with a variety of different caregivers, educators about the importance of recognizing mental health issues, the importance of understanding treatment options that are available so that we can share those options with our kids so that they're not living stressed out, that they're not living completely challenged by some of these mental health issues. So I really appreciate that NAMI recognizes that early intervention is important, that kids are struggling, and we want to make sure that they don't have to continue to struggle without the appropriate supports in place.
Yeah, if you are any human being interacting with a kid, you take part in this story, right? So we tend to think about who's responsible for the upbringing of the social emotional health of kids. It's not just teachers, it's not just parents. It's really any adult who's interacting with a kid because every single kid who interacts with an adult has the opportunity to learn positive coping skills. They have the opportunity to learn self-regulation techniques and to have an example of what it means to handle stress or challenges in a positive way, right? And so really it's all of our responsibilities as like a tribe, as like a culture to be able to pull our kids along and to say, hey, if you're struggling with this, to your point with the book, it's you're not alone, right? And I actually heard this phrase, you mentioned this when it came to not looking at kids as whole people or thinking about their memories and that this is not something they're going to remember, right? Like sometimes you'll talk to parents and be like, no, I don't want to take my kids to Disney World because, they're just not going to remember it. And of course, there's some wisdom in that, but we carry that over into our mental health. And when we think about the things that we do in front of kids and the way that we interact with kids, like it's not going to matter as much. I heard somebody call it adultist or adultism, meaning like it's where you don't look at kids as full people and recognize and validate their feelings. Have you heard that phrase? Is that something that you've come across in your experience?
Yeah, all of this totally resonates with me, and I just love all of the points that you highlight because I think a lot of adults look at kids and just think that they'll figure it out on their own. that all of the social and emotional development will just naturally happen. But as adults, we all have a shared sense of responsibility in providing our kids with the tools that they need for their social emotional development. And we have to be very intentional about it and not just assume that they'll figure it out, right? And so we're also serving as models for our kids for how to deal with really intense emotions, how to deal with stress, and also how to talk about it. And we can't make assumptions about kids that kids are little adults. Kids are human beings who are fully capable of experiencing all of the different emotional states, but they're experiencing intense emotions for the first time without a toolbox full of skills. And so, what we need to do as adults is we need to take that empty toolbox and we need to fill it up with different skills that kids can use and implement on their own throughout their development to deal with intense emotional states, to help better regulate their behavior if they're feeling stressed out. So we really have to not make assumptions about our kids thinking that they could figure it out. We have to fully equip them with the tools that they need to develop emotionally very strong coping strategies. And we need to recognize that we are models. We are always going to be models for our kids, and our kids are paying attention. They're noticing our interactions with them, with other people, how we are sitting with ourselves, and how we are responding to stress. So, a huge focus of this book is just allowing caregivers and other adults to take a step back and to reflect on their part in the kids' social emotional development and to feel empowered that there is some positive things that they can do. And it doesn't just mean that you have to be a mental health clinician, a mental health professional, a psychiatrist to do these things. We all, as adults, are fully capable and fully equipped to teach these things to our kids.
This episode of Treatable is brought to you by Sandstone Care, which helps teens, young adults, and their families overcome challenges with mental health, substance use, and addiction. They provide age-specific, individualized treatment plans centered around your unique situation and goals, and they only use evidence-based therapies to help you get there. They keep their group therapy sizes small so folks can connect with others going through the same struggle and so that you never feel alone. They also give academic and vocational support to help you improve your grades or to get started on your career path. And lastly, because they know that mental health and substance use affect the people closest to us, they provide support for the whole family through their family therapy program. To learn more about teen and young adult treatment options, go to sandstonecare.com. Change is possible, and Sandstone Care is here to help. Yeah, and you might look at these things, and I'm sure we're going to get into these in a little bit, but when we're unpacking positive coping mechanisms or mindfulness or self-regulation techniques, ways to deal with stress or challenges in a helpful way, it might seem really complicated at first, but as soon as you start to unpack these, the thing that people keep saying when we talk about this kind of stuff is, I wish I would have known this earlier, right? I wish this is something that I would have been taught in middle school. I wish I would have had a whole class in school where we unpack these. And the challenge with that is that this can't be limited to a classroom. It can't be limited to just a teacher doing social emotional learning for 45 minutes twice a week or once a week, right? Because life happens and we learn these skills and see these skills happen, and we need to have them displayed for us in everyday life circumstances, which is why this is more than an episode for teachers, more than an episode for parents. But I'll get off of my soapbox why everyone needs to hear this thing. But just know, like, no matter what, if you interact with any little human, you need to know what we're going to be talking about today. There's going to be some really helpful stuff. So let's talk about this first part when it comes to how to tell if a kid needs support. Now, we know that kids often will display signs of needing mental health support different than adults would. They're not always going to come out and say, yo, I think my mental health is really struggling today. I think I might be suffering burnout. That's not within their social vocabulary yet. So, when you're talking with people, caregivers, how do you talk to them about how to identify the signs that a kid might need some help?
Yeah, so I like to focus on three things. I want caregivers and adults to notice their kids and to look for a pattern and a change in the kid's behavior and their emotional state. I also want them to take the time to sit down and have a conversation with their kid. So to listen to the kid and to hear from the kid what might be contributing to this change in behavior that the adult is noticing. And I also want adults to lock in on the moment, to be fully present during this conversation rather than to immediately jump into problem solving mode. It's really in that moment, it's about connection and making the kid feel heard and understood, and together thinking about next steps that make the most sense for that individual child. Now, me talking about noticing a pattern and change in your kid's behavior or their emotional state, it's so key because a lot of parents, a lot of caregivers say, "Well, I thought this was typical behavior for a kid of this age. I didn't really think much of it." But if you notice that your kid who is, say they're in 3rd grade and they love to go to soccer practice all the time, they were talking about soccer practice all the time, they were talking about going to their best friend's house. And then all of a sudden, over the next few months, you start to notice they're not interested in playing soccer. They're not interested in hanging out with their friends. That's a change in their behavior. That's a change in the pattern that you've grown accustomed to, that they were super on top of going to their friend's house, playing soccer. So if you notice a shift in their behavior, be curious about that rather than making assumptions about it. Because if you engage in that conversation in which you're listening with curiosity about what's going on, they may say to you, "Well, the reason why I'm not into going to soccer is I really don't like my coach. My coach is really mean and I'm over it." Okay, now you know. Versus, "I'm not into soccer because I'm just tired. I'm not sleeping really well. I'm just not enjoying things like I usually enjoy." That gives you a sense as to where the kid is at. Now, a lot of people will say to me, "Well, how could a 3rd grader, like, could they talk to you like this in a meaningful and intelligent way?" Yes, they can, because kids have the tools to be able to recognize their emotional state and might have some insight as to what's contributing to the behavior. So, engaging in a conversation with them about that can be helpful at any age, including preschool age. So, including 3-year-olds, because that's when they're actually aware of different emotional states. They're aware of their emotions and how they might behave in relation to the emotion. And they're seeing how other people are displaying their emotional states and how they're behaving. So they have that awareness and they can kind of guess what might be contributing to that. "Oh, I noticed and my mom is kind of angry. And when she gets angry, she shouts and she gets really tense. Something bad must be happening in their life." It could just be as basic as that, but we want to give our kids an opportunity to reflect that. The other thing is that, especially with teenagers, when we see kind of a change due to hormones, due to certain interests that tend to emerge during those adolescent years, they're more focused and preoccupied with their friends. They want to hang out with their friends all the time. They want to talk to their friends all the time. They don't want to talk to you, right? But if you notice that a kid is becoming more withdrawn, a teenager is becoming more withdrawn, spending more time in their room, and they're not wanting to hang out with their friends and they used to, that's a red flag. That's a signal that things are different. And that should prime you to have a conversation with them and say, "Why aren't you hanging out with your friends? I'm just curious about, why do you think things are different? What's going on?" And they can share that information with you. And then you lock in, you hear them out rather than jumping into problem solving and saying, "Well, That's not that big of a deal. Who cares if Lindsay didn't invite you here? Who cares if this is happening? Just keep it moving, what have you. That's not helpful to that kid. So these are all the things that I touch upon in the book, but these are also things that caregivers and other adults should be mindful of is a change in a kid's pattern behavior. That is usually the most helpful thing to be able to differentiate typical behavior versus something else is going on with your kid.
Got it. So just summarizing what I heard you saying, there's three main things that we want to focus on. One is noticing changes. What are the changes that you're seeing within your kid? Some of those changes might be a loss of interest in hobbies or sports or things that they used to enjoy. Maybe using substances to cope with stress. You find your kid, there's a difference between like experimentation, like I'm just trying something, versus, hey, I noticed that like this kid is drinking consistently when they're feeling stressed. It's like a common thing that we're seeing. Also, another change is isolation. Maybe they used to be more social, now they're isolating themselves. School performance or work performance can be one of those. If you've noticed your kids' school performance has changed from like an A to a C or a B to a D, usually a two-grade bump or change. That's a big one. The other one is like mood outbursts, right? So are they typically responding with anger or sadness to things that wouldn't normally trigger them or make them feel that way? And given teenage hormones and hormones in general can make those kinds of fluctuations, but it's up to you to be perceptive of how you know this kid. And is this normal for them? Maybe, maybe not. And then also another one I've seen is like a change in friend groups. Have you noticed that maybe they're not isolating, but the people they're hanging out with are different? So the first thing is to notice changes. The second thing is to listen. And a key part of this, it sounds like, is asking open-ended questions in a non-biased way that doesn't have any accusatory tone to it. And kids can tell, right? When we think about the questions that we ask, it's really just about being curious and wanting to know more, providing a safe space for them to be able to open up. And then three is to lock in and be mindful of, the situation of where they're at. And by be mindful, I'm not multitasking. This is not, I'm sitting with this person. They have my undivided attention. And I'm just not trying to solve their problems. I'm not trying to like fix anything. I'm just trying to make sure that they feel understood. Did I miss anything or is that right?
Oh, that's so spot on. And I really appreciate the summary because, like you said earlier, this information is so important for everyone to know. And it sounds like it's simple when we're describing it, but the simple things are the most impactful and meaningful things. And all of this is certainly spot on. And to build off of what you had just said in your summary in terms of trying to understand if this is typical behavior or if this is a signal of a more concerning issue, is I just want to highlight two things. Number one is how are they functioning in general? Like you mentioned, if we see a decline in their academic performance, if they're not functioning at the same level socially, talking to people, wanting to hang out with individuals, but also when it comes to functioning, we need to think about how kids are physically functioning. What is their energy level like? How are they eating? How's their sleep? Are they able to get out of bed and brush their teeth, shower, put on their clothes? Have you noticed a change in those sort of things? So, noticing a change in how the kid is functioning, including physically, is really important. The other thing I share with caregivers is it's hard for them if they notice a problem just between them and the kid, or a problem in the classroom, or a problem just at home. They might think it's a larger issue than what it actually is. So in the book, I talk about what I refer to as the distress radius framework, because as adults, we could be concerned about what we're noticing in a kid. We can notice that they're not talking to us. Maybe they're more argumentative. Maybe they're more irritable. But if you are hearing from other people, if you're receiving information from school, from other adults in the kid's life, that their behavior appears to be unchanged and totally fine, but you have a lot of concern. You're like, no, this is the end of the world. This is not good. Then maybe that might suggest that there's something about our relationship and our dynamic that might be contributing to this behavioral change, that might be contributing to this mood state. And so when I talk about the distress radius, we want to know how broad does this change of behavior go? And does it impact other areas of this kid's life? Does it impact other areas of this kid's ability to function? Does it seem like it's radiating out and spreading outside of the four walls of the house? And it's going out into their interactions with their friends, with their coaches. It's impacting their schoolwork, other things. So if we start to notice that this change in behavior is spreading out and radiating to other places, and it's having a larger effect on other aspects of their lives, then certainly a red flag. But if you're just noticing, oh, this seems, based on the information I'm receiving from people, it's just a issue between me and kid, we need to look at our dynamic and to understand why that might be the case.
Yeah, that's a good point. If you're conducting any type of investigation, if you were a detective, you would talk to multiple witnesses to see if their story corroborates, right? And it's kind of a similar situation. You're trying to paint a picture, and the more different perspectives or point of views that you have, the easier it's going to be for you to have a more complete picture. And then to also, to your point, be able to tell, hey, is this something that is a problem with our relationship, or is this a problem like overall with the kid? So some of the other things that you mentioned earlier on, you're talking about emotions and having kids experience these emotions for the first time. I used to be a teacher. I taught middle school language arts, 7th grade. And I remember I had a really terrible habit. Now I look back, that when kids would come to me with distressed feelings, like a primary thing that I would do, and this kind of transitioned us to our second spot where it's, how do we communicate to folks? I would say the words relax, relax, relax. Like it's not that big of a deal. Relax, relax, calm down, calm down. And what I was doing in that time when I look back is they're coming to me expressing their emotions. And what I was doing was really, I was invalidating their emotions. I was saying like, I wasn't showing them a better way to process how they felt. I wasn't showing them like a unique way or a more positive way to be able to communicate. I was just telling them to stop feeling so much, right? And when we're working with kids, kids can only, and really humans can only learn positive communication or coping skills from other humans. We have to have it modeled for us. We have to be able to co-regulate before we can self-regulate. We have to see somebody giving us an example of experiencing stress or discomfort and reacting in a positive and calm way before we know that's an option for us, right? And so maybe I've identified, okay, my kid's got something up. Something's not right. Or I see this kid and I know there's some underlying thing, right? I'm not trying to diagnose them with like ADHD or depression. The diagnosis is not the thing. What's my next step and how do I then communicate with them?
Ooh, I love that example that you gave about your years as a teacher and our automatic tendencies or response or reactions when kids are experiencing distress. We want to take that pain away from them pretty quickly. And we want to provide reassurance and saying things like, relax, it's not a big deal. It's okay. It's okay. Actually, is kind of driven by our own anxiety about not wanting to have to sit with the kids' distress, right? We're like, if we can just take this away, I'll feel better. And hopefully you will as well. But you bring up an excellent point that if we quickly minimize the person's, the child's emotional experiences, we invalidate that, they don't have an opportunity to learn any tools or skills for how they can navigate and better tolerate that moment right now. But if they were to experience that again in the future, they're left without any skills. They still don't know what to do besides approach an adult and share this, which I'm happy that your students felt comfortable doing with you. And so what I tell adults is that when you ask kids, when you ask teenagers, how are you doing? To really lean into the question and be ready and receptive to whatever it is that you'll receive from them, whatever it is that they'll say, and just be there fully present in the moment. And I know that we're so used to being quick and it's a fast moving society. How you doing? Everything's great. Oh, okay. That's fine, blah, blah, blah. But let's really take the time when we're asking these questions to our kids, because that could be that one opportunity, that one moment in that kid's day that can turn everything around. Because we don't know the type of thoughts or struggles or difficulties our kids are carrying inside on their own that can make it such that they can make a decision that's not good in that moment. So we want to take full advantage of all of these opportunities that we have to connect with our kids about their emotional state. So how are you doing? Tell me, how are you really feeling? When they tell you how you're feeling, say, thank you for sharing that with me. It's so important for me to know what's been going on because this allows me to support you through this. And I really want to be here for you. Thank you so much for allowing me to be here for you, right? Because kids need to know that they matter and that other people notice them and that people care about them. And so you are showing that you notice them, that you care for them in that moment. And to ask them, I wonder, in this moment, what do you think would be helpful for you? What do you think could make things a little bit easier for you right now? How can I support you in that moment? It's so important because they might be able to say to you, I'm having a hard time staying in this classroom right now. I'm having a hard time focus. I really would like to just go to the nurse's office. Can I just get a pass to go to the bathroom? Absolutely. That's what I can do for you in this moment. So it can be something as small as that, or it could be something as big as, Mom, I'm really, really struggling, and I think I need to talk to someone about this. It could be as big as that. But you want to hear from your kid first, hear from the child first, what they think that they need in that moment, and talk about what makes the most sense, what you have access to in that moment, what you don't have access to, and just collaborate and problem solve together.
I want to point out two different types of kids you might see. I have a little brother. He's going to be a senior in high school. And especially you'll find this with teenagers, but also middle schoolers. When you ask, what's going on? How are you doing? You often get like monosyllabic answers like, oh, I'm okay or fine, or, there's a lack of willingness to kind of engage sometimes with those. What do you do when you're noticing that pattern within trying to talk with somebody about how they're doing and they're not as responsive?
Yeah, this is a really great point. So, say if you want to engage in a conversation with a kid or a teenager, and you're concerned about a change in their emotional state or a change in their pattern of behavior. Say, I've noticed a change in this. What do you think is behind it? I don't know. Everything is fine. I don't care. Whatever. I don't want to talk to you. I'm keeping it moving. What you did in that interaction, even though it wasn't satisfying for you because you felt like you were being dismissed and shut down, what you communicated to your kid is, I notice you. I'm taking notice of you. And these are the things that I've picked up on. Because a lot of kids don't fully appreciate the fact that they matter or that other people are noticing them. But if you and when you communicate that, you're like, wow, people are taking notice of me. My goodness, I guess the way that I'm feeling inside is kind of showing on the outside, right? So you are communicating information to that kid. In addition to communicating information to the kid about what you've noticed, changes in their behavior, you're also planting a seed in your kid's mind that you are ready to talk about their mood. You are ready to talk about their feelings. And what you can do is after you planted that seed and initiated that first conversation and they shut you down, you can have follow-up conversations with the kid, whether it's every couple of days, once a week while you're driving in the car, and say, I wonder, how is today? How have you been feeling? Then they'll shut you down again. But what you're doing is you're actually watering that seed. And you can add even more water to that seed to allow it to grow even more so by you modeling how to talk about how you're feeling, right? Because maybe your teenager or your kid doesn't even know how to respond to that. Or maybe they don't even know what you're interested in hearing. And so if you say, "How you doing? How is your day?" "I'm fine. Everything is fine." Well, I just want to let you know, like, things have been really rough for me over the last week or so. I've been feeling really, really worried about, I don't know, how I'm doing at work. I'm feeling worried just about certain things. And I notice that when I'm worried, I can, I don't know, keep to myself and things just don't feel right. I wonder, has that been a part of your experience or when you worry a lot, is that something that happens to you? No, mom, this is stupid. I don't want to talk to you. Again, you're like modeling how to talk about it. You're talking about, how it impacts you. But these are all opportunities to just allow the seed to grow and to flourish to a point in which maybe 2 months later, they finally are receptive to engaging in that conversation with you that can have a tremendous and profound impact. So I tell caregivers and adults, it's about the long game here, and it's about continuing to model, to reinforce this, to plant the seed, to water, to watch it grow, but to not expect and to not have this expectation each and every time you engage in a conversation with a kid about their feelings that they're going to give you everything. That's not going to happen. So I think just setting realistic expectations for the outcomes of these conversations is so important.
It's funny, as you were talking about expectation, I was writing the word expectation. So we're on the same wavelength there. It is challenging to separate your expectation with the kid's needs. You might come into a situation and your expectation is you ask question, they tell you problem, you give them solution. The expectation that you might have as a parent. But remember that teaching and modeling often takes place outside of the normal context of a classroom. And sometimes, again, people have to see somebody do something and respond to stress in a situation before they can accept to do it themselves. So if I come into an environment and my entire goal is to let this person know that I'm there for them and that I want to understand where they're coming from, that I'm not going to judge them, that it's like a safe space to be in, right? That you're not coming in there trying to fix it. You're not trying to invalidate their feelings, that you're not trying to just give them a solution, that you're actually just trying to make them feel understood because they have a question in their mind. Everybody has these questions in their mind. Does this person understand what I'm going through? And if the answer to that question is no, we go no further, right? You can't proceed if the person doesn't understand. But if the answer to that question is yes, this person understands what I'm going through, then the second question unlocks, which is, can this person help me? You don't get to one without the other. And so your first step, to your point, is just making sure that this child feels like you understand where they're coming from. What I loved about what you said, how do you get there if the kid is unresponsive? The key thing is vulnerability. Again, like all regulation skills, like all communication skills, you have to model it for other people to repeat it. How can you expect a kid to be vulnerable to talk about their inner thoughts and feelings with you if you've never done that with them? There is a power dynamic there that's already at place between kids and adults. In order for there to be some sort of equal footing in which somebody feels safe enough to be able to open up, we have to level the playing field by being willing to be vulnerable about our emotions and our feelings and our thoughts, right? That means that your veneer or the facade of perfection is definitely going to come down. That means that you will not be cast in a perfect light. You will be seen as a human. But what that also shows this person is that I can be myself around this person. If you think about the way that traditional and historical ways that people deal with emotions, it's through isolation. If I'm a kid and I'm acting up in class, I get put into isolation. I get put into timeout. I get sent to the principal's office. I get sent out the classroom. And what that tells and communicates to the kid is if I am myself around these people, I am not accepted. If I express who I really am, then I can't be a part of the group. So what we have to do first is to model this vulnerability so that people feel comfortable. And there's a psychological principle behind that. Vulnerability begets vulnerability. When leaders or an organization or parents, people within a group are vulnerable, you'll see that other people will then feel safe to be vulnerable too. But it starts with the adult in the room. It starts with the leader in the room. And if you're listening or watching this, that means that's you. Any other strategies or frameworks that you think are helpful for parents when it comes to communicating and talking to kids about their mental health?
I think the other thing that's important is for caregivers to be mindful of their own mental health and how that might impact the kids in their lives, right? There are people who are experiencing anxiety, and perhaps a lot of the conversations that they attempt to engage their kids in around their mental health might be fueled by their anxiety. And so, if it's driven by your own anxiety, your anxiety might get in the way of your ability to be fully present with your kid to help support them. So, I encourage caregivers to notice if there's a pattern and change in your emotional state, how it is that you're behaving, to notice that in yourself, to listen to that, and to get the help and support that you need. Because we need you to be a good model again for these kids. And if you are struggling, then it's just going to be hard for you to provide those strong and positive coping strategies. Also, them knowing that you are getting your own mental health supports demonstrates and models the importance of take care of your mental health, right? So, as adults, we're so good about talking about going to the doctor or primary care doctor or primary care provider if we have a headache or stomach aches and all of these things. But we don't really provide good modeling for who to talk to or where to go if you're experiencing more intense mental health related issues. And so having that being on full display or having conversations about the steps that you're taking to support your mental health is actually important and incredibly valuable for kids. And as they grow up, they'll have a better understanding of their family history of mental health related issues. And so having that knowledge about how mental health has shown up and presented in their family, it's so important to have that so that they can be better equipped to take care of their own mental health, for them to recognize what are some of the signs and symptoms, say if they're a little bit older, they're teenagers, they're going off into college, that they'll be able to notice a change in themselves and think to themselves, oh, this happened to my mom. She went and saw a therapist. Maybe I should do the same. So I think
Mm,
that that point about vulnerability, I think it's helpful to be vulnerable about any specific mental health related challenges you may be experiencing, and to do so in a developmentally appropriate way when you're talking to your kids, not to go into exquisite detail about everything, but to summarize it and to say, I have a history of having periods in which I'm really, really sad. Or I had this history in which something really bad happened to me, and it's been really hard for me to stop thinking about that bad thing, right? You can just use
right.
simple, plain terms to talk about that as a way to kind of normalize the fact that mental health related challenges are medical and physical challenges too. They're all woven together. So I think that modeling is important to provide as well.
Yeah. And, we've talked about on this podcast before that we have mirror neurons. We come into this world with the ability to look at our primary caregiver and connect, right? That when they're smiling, we smile. And when their breath is calm, we're calm. And when they're anxious, we're anxious, right? When their heartbeat is fast, ours increases, right? And so we learn to look at our caregivers to be able to regulate our emotions. And when we graduate from being a baby to a toddler to, a kid and to being a preteen and all of these things, the complexity of the problems that we need help from with our caregiver are different, but our need to be able to look to the adults within our life to be able to see what to do doesn't change, right? And we're doing this all throughout our brain development. And so we have to be able to remember that every single time you're around a kid, they're watching you and they're watching how you deal with stress and how you deal with challenges. And if we're expecting kids to open up about their mental health, to be able to work on themselves, to be willing to change, to grow, to be able to talk about their feelings, express their opinions and their thoughts in a way that's not harmful or combative or diminishing to other people, that first needs to be modeled, and it can start with you. And so the good thing is, if you're listening to this or if you're watching this and you're thinking, okay, this is a good start, like this is helpful, but I don't know if I caught on to everything, is that you wrote a book, right? You have a whole book about this very topic. So maybe can you tell us a little bit about your book and where people can go to learn more about it?
Yeah, thank you so much for that opportunity because as a child and adolescent psychiatrist, I see people in my clinic just for a brief period of time. And a lot of caregivers bring their kids in hoping that I can fix their kid or solve whatever problem or issue they're concerned about in their kid. But the reality is, they're seeing me for 30 minutes, maybe an hour max to do an evaluation, but they're spending the overwhelming majority of their time at home, at school, out in the community. They're spending most of their time in the presence of non mental health professionals. And so I wanted to write a book that would empower caregivers with the tools that they need in order to support their kid outside of all of these appointments with mental health providers, because that's just one piece of the puzzle in terms of supporting the overall social and emotional development of a child. And so I know that, yes, I have expertise because I went to medical school and did residency, but that is clinical expertise. The expertise that is so important is coming from those with lived experience. And so what I wanted to do was to have this book to reflect the words and experiences of people within the NAMI community and beyond the NAMI community who have walked this journey on their own already, with their own children, with their own families, with themselves as well, and thinking about teachers and coaches. And so I was really moved by the stories that I heard when it came to having a kid who was dealing with a mental health challenge or the kids themselves, because I interviewed kids, elementary school age kids, as part of this book so that adults can learn what it is that kids need when they're experiencing pretty significant mental health issues. So all of those interviews help to kind of shape the overall structure of this book that really focuses on how to connect with your kid, how to communicate with your kid, how to understand your kid's behaviors, and how to know when it's time to get more supports, whether that's specific mental health supports, but also supports for your kid that are non-clinical in nature, talking about communities, talking about going outside of your own family, your immediate family, and talking to people in your faith-based community, talking to people in your local community, and talking to people within the community of NAMI. And that's why the book is called You Are Not Alone, because a lot of caregivers feel like they have to fix the mental health issue of their kid just and keep it very private and that's it. But it takes a village of support, of connection, not just the clinical support, but the social supports of so many others to make it such that kids have what they need to develop. So it allowed me to put all of this information into a book so that parents felt empowered to take care of their kids outside of appointments with me. And so this book is available right now. We have a website, youarenotalonebook.org. And we really hope that people get their hands on this book because all of the proceeds from this book will go straight to NAMI. And so all of the money that's made from this book will be able to continue to support the programs that NAMI has in place across this country. So I hope that people tap into this valuable resource and that it helps shine light on this mental health journey that can be overwhelming and confusing for so many.
And what a valuable resource. What a incredible perspective. What a humble way to approach the subject, to be able to come to all of these other people who may not have the credentials of being a mental health practitioner, but have a ton of lived experience, as you said. And it's not up to the schools to do this. It's not even up to just the parents. It does take all of us. So listeners, watchers, you can find the links for all of those things in the description box in the show notes for this episode. Make sure that you check it out. Make sure you get a copy. By the time this episode comes out, it'll be ready for you. So go get it. And y'all, listen, this whole children mental health challenge, the vast rates of mental illness that we see within kids that only seem to be increasing with the different pressures and technologies that weigh in on them, it is real. And as Dr. Crawford has explained, it is much more common than we might think. But with the help of resources like this book and with the help of you, it's also treatable. We'll see you on the next episode. This episode of Treatable was edited by Daniel Lopez. The intro and explanatory sections of the episode were written by Alexandra Kruger. The theme song was created by Sebastian Gonzalez, and the cover art for this episode is created by Joel Daniel. If you got any value from this episode, it would personally mean the world to me if you would leave us a 5-star review wherever you get your podcast. It helps to spread mental health awareness to more folks, and I read each and every comment that people leave. So tell us what you appreciate about the podcast, and you just might hear us feature it on the next episode. All of my love, and we'll see you on the next one.